Dr. Joe Congeni in our studio, Akron Children's Hospital. And I guess, Joe, you wanted to talk a little bit what a lot of us Cavalier fans are talking about this week, and that's eye injuries.
Parents face this a lot in their kids, and athletes face these a lot. So let's talk about, really, there's three major ones that we see. And I spoke to a couple of my ER friends to see has their management been much different. One of those being my son is an ER doc in Charleston, South Carolina. So the three big ones that we see, first of all, let's step back to, we always talk about the mechanism of injury. How can it occur? If you saw game one, I hate to keep going back to game one. If you saw game one and they slowed down what happened to LeBron in game one, it's the absolute ideal mechanism of what happens with that injury in sports. It was a poke and then rake of the eye. And here comes my editorial comment. It seemed like the guy who did the poke and rake in the eye maybe has done this before or knows what he's doing with this thing. Sorry about that. By the way, he even argued the call. But anyway, when somebody in sport gets poked and raked, what happens? Here's the problems, three problems that can happen. Number one is the most benign of these, no big deal, but looks the worst, is called a subconjunctival hemorrhage. We love fancy medical words.
Yeah.
Right? So the white of the eye has a thin covering and everything. It has to have blood vessels, and you break the small blood vessels so it bleeds over the white of the eye. And people will see that blood, and we saw it in game two, actually, much more than game one with LeBron. And it looks really bad, but it heals very nicely, usually in 48 hours without a lot of complications, and does pretty well. Number two is probably the most common thing that happens in eyes if you're dealing with your kids or athletes. It's called a corneal abrasion. The cornea is that thin, clear covering of the joint, and what happens with the rake part of the poke and rake is that people will get a laceration, will get an abrasion, a deep bruise around that area in the eye, and that one is painful. That one leads to some blurred vision. LeBron complained of some blurred vision, and pretty sure by what he said in his post-game press conference that he had at least some degree of a corneal abrasion because they treated him with antibiotic drops. The big thing, you don't want to take a chance on infection, so antibiotic drops and treatment for pain because those are painful. And the way they know in emergency rooms still is we use a stain called fluorescein stain. Any parents that have been through this, we stain the eye and then use a blue light, and you can see these cuts to the clear covering very well. And if you see these kind of cuts in this, in small lacerations, small cuts in the covering of the eye, that's a corneal abrasion. They heal usually within 48 hours with antibiotic drops, but they should be watched real closely in the first 2 days. And if they're going in the wrong direction, need to see an eye doctor or an ophthalmologist.
The eye is extremely resilient, isn't it?
It is very resilient. And there's a ton of blood vessels. That's why the subconjunctival hemorrhage, the thing LeBron got, happens, because there's a lot of really small blood vessels. And anywhere where there's a lot of blood flow, Ray, is a place that heals very quickly. So these first two are generally superficial injuries that heal within 2 or 3 or 4 days at the most. So they're well on their way to healing. The third one is called a hyphema. That one doesn't heal as easily. And a hyphema is with a bad poke in the eye that leads to actual bleeding in the anterior chamber. And that bleeding can cause problems in the front of the eye with complications that can be a real big deal, like glaucoma, which is too much pressure in the eye, like re-bleeding, where it'll bleed a day or two later and you see the blood level going up. They call it a kind of a goblet look because it looks like a glass of wine in the eye because you can actually see the blood sitting in the front of the eye. But it has some propensity in bad ones, some ability to become a bad complication. And we saw it here. The poster child was Orlando Brown, if people remember, was a lineman for the Browns. Of all the oddities, he was called for holding. They threw the flag. It went through his face mask, hit him in the eye, caused bleeding in the eye. He was legally blind for 3 years after he had a hyphema in the eye. So that's clearly not the case with LeBron. And those people, you rest them, they're in with an eye doctor, he wouldn't be playing. And what it looks like is that bleeding around the white part of the eye, subconjunctival hemorrhage, and probably some degree of a corneal abrasion that he was treating with antibiotic drops. And any blurring he had in game one, maybe some, but I didn't hear about it in game two, should really be healed now if it's one of those first two
That's
problems.
what I was going to say. Limitations, and Would we expect goggles, or at this point is he beyond that?
He's beyond that. That would have been in game 2, but if he had a bad laceration, a bad abrasion, corneal abrasion, that would have been more in game 2. But you hit the nail on the head, as usual. You're on it. There's a lot of blood flow in this area, so although it's a real delicate area and so critical for everything we do, these usually heal very quickly. And far and away, those first 2 that are relatively benign problems that improve in 24, 48, 72 hours, those are the very common ones. And the last one, the Orlando Brown one, the bleeding in the eye, is very rare. But they do occur at an ER like Children's. We'll get a couple a month.
Joe, one other thing I wanted to bring up to you, I saw 3 more players went on the Major League Baseball disabled list yesterday with abdominal strains. And this is the injury that we've seen really in vogue in baseball in the last 10 to 15 years, that really we saw it before, but not like we do now. Why are we seeing more of the abdominal strains now, pitchers and hitters alike, that we didn't see before?
Yeah, I think, Ray,
Overwork?
I think, number one, they probably were a higher propensity before, but we didn't call them that specifically.
Okay.
And we just said, hey, people were out with a rib cage problem, perhaps, or something, and called them other things, partly. But secondly goes back to, and I can't help it, the training. These athletes are so well trained, and they have to. This is their craft. This is where they make their money. Everybody has come to understand the core is the most important part in most all sports, and particularly that rotation in baseball when you're hitting or pitching, so critical. So working on those rectus abdominis muscles and those obliques on the sides, those are things that people work on. This is their craft, and this is where the money comes from. They work on those year-round. And so as you push those to a certain point, they're more prone to have strains of those muscles and increased torque. The increased torque, bat speed, there's always these new things as you see what the bat speeds are, and the ball miles per hour as it leaves the yard now on home runs, the exit velocity, that comes directly from increasing these, and you can only push it so far. And so on the other end, what ends up happening is that these people with so much torque and bat speed are going to end up overloading those muscles and straining them and tearing them, and the tears last a long time. And so some of our guys, you thought they were going to be out for a couple of weeks, and it turned out they were a couple of months.
I go back to C.C. Sabathia and Cliff Lee. Remember, back-to-back years, they had those strains, and again, probably workload and everything. They ended up being out long periods of time, I remember. Good stuff this morning. Always good seeing you, my friend. Catch up with you next week.
Sounds good. Thanks.
There you go. Dr. Joe Congeni, Akron Children's Hospital, joining us live this morning.